Welcome to the Board of Health. I'd like to call the meeting to order. The next meeting, just for your awareness, is November 9th at 6:30 p.m. Do I have a motion to approve the minutes?
So moved.
I'll second. Dr. Abraham?
Aye.
Myself, aye. The minutes are approved. Next on the agenda is review and discuss the number of tobacco retailer permits allowed in Shrewsbury. Requested by Donald O'Neill, Esquire, on behalf of Yatco Energy.
Please come on. Yeah, that's a
Right here.
microphone. Yes.
Okay. Good morning. My name is Donald O'Neill. I'm a lawyer in Worcester. I filed this request with you on behalf of Yatco Energy. And what we're here to do is to ask you to take a look at reconsidering the cap in the terms of tobacco licenses that are issued and possibly increase the number. Our situation is that we're looking to, at a location in town, to build a gas station convenience store. My client has a number of other stores throughout the area, throughout the state. Basically, one of the items that are offered in the gas station convenience store are tobacco products. We have a lot of customers who come to the stores. Their expectation would be that they could purchase tobacco products there. Every other store that we have has a tobacco license. And one of the considerations, I think, in terms of setting the cap is that in terms of a new business coming into town, this could be a situation, and it in fact is a situation here where you're creating sort of an unfair advantage for the existing license holders in terms of a new business coming to town that would be in competition with them without the ability to offer the same products. And I think that discourages construction of newer facilities in town. I also did take a look at, I understand that Worcester just passed a cap within the last 2 weeks. That's at 235. The population is 205,000. So that works out to be about one license per 956 or 59 people. The cap in Shrewsbury at 20 with a population of somewhere around 32, 33,000 works out to be about one per 650. So, and we think that given Shrewsbury's location and the long stretch of commercial road frontage and zoning that the town has, that the people who are serviced at the stores are not just coming from Shrewsbury, they're coming from all over, and they're traversing through town on Route 9, Route 20, and stores of that nature, so that we think that the cap may be too low, given the amount of commercial area that Shrewsbury has, the location of the highways that go through town, and the number of people who pass through town, not just Shrewsbury residents, but others as well. And in this case, again, it's a significant loss of expected revenue from a store location if you don't have the ability to sell tobacco products. I know that there is a concern possibly about overall about sales to underage people, things of that nature. We do have a system in place, that requires carding of anyone who comes in to purchase tobacco products and having to enter, a license through their system, which is specifically designed to avoid that happening, which is the responsibility of course, of all tobacco license holders. So we do feel, or would ask, that you consider this and take a look at it and just see if maybe that the cap might be increased somewhat so as not to discourage new businesses from coming to town.
Thank you very much. Any questions from the board?
Madam Chair.
Dr. Abraham?
Attorney O'Neill, is your client's position that this is in their business interest? This is not in public health interest, correct?
Well, I mean, The public health interest is, I mean, that tobacco are legal products, that there are adults out there who have perfect right to smoke if they choose to smoke. And they are, feel that this is basically, that it's up to them to determine what's right for their health, I think, without the Board of Health telling them whether they can smoke or not.
Correct, and I don't believe that we as a Board of Health have ever told somebody whether they should smoke or not, nor are we making that position now. But our responsibility is the health of the citizens of Shrewsbury. And so from that standpoint, I'm clarifying that your position or your client's position is this is strictly from a business standpoint, correct? There's an economic
Well,
advantage to the business, as you just pointed out.
Yeah, we are in business, and that's our focus. However, I would say that if you are in business, you also pay taxes to the town, and the taxes that come from commercial development help support the town's overall services that are offered by the town, including the Board of Health and the schools and the rest of it that generate tax revenue. And we feel that, again, some consideration needs to be given to imposing a cap without taking into consideration that towns grow, places grow, population numbers increase. And we just feel that perhaps setting the cap where you did is just probably the nature of the fact that that's how many licenses were out. When you impose the cap was probably, we're not going to take them away from people, we're just not going to offer any new ones. But that does create a situation where, for future growth within the town, and if there were, you know, the town of Shrewsbury, the population doubled, then, you know, there would be more stores, and there would be a need for a greater number of licenses. And I think if you look at the per capita situation as a comparison and look to other communities that are similarly situated, then that's a better way to set the cap than it just happens to be. At the time that we imposed the cap, there were 20 licenses. If there were 22 licenses when you impose the cap would have been 22. And I understand that in years past that there were in fact more than 20 licenses that were issued. So really it's just sort of a function of how many licenses were outstanding when you imposed the cap. If there were 22, 23, 24, the cap would have been at that level. So I don't know that there's anything magic about 20, other than the fact that that's the number of licenses that happen to be issued when you imposed your limitation. And the fact that there had been not a whole lot more, but a few more in the past maybe is an indication that that's a better number to look at in terms of historical number of licenses that were issued and what's an appropriate amount for the town to impose the cap at.
Attorney O'Neill, where is the proposed business location?
The location is,
It's on 193 Hartford Turnpike. I'm Steve Benincasa. I'm the property owner. The property is at 193 Hartford Turnpike. It's directly across the street from Market Basket corner.
Boston
Lake Street.
Turnpike. 193 Boston Turnpike by Whole Foods?
Hartford Turnpike.
Hartford and Route 20.
Corner of Lake Street and Route 20, directly across the street from Market Basket.
And the only thing I would point out with respect to that too, again, is that's a commuter, you know, there's a lot of traffic on that road. They're not just residents of Shrewsbury.
Do we know what proportion of the population is under 18 of that 32 to 33,000? I think that would be an interesting data point to look at.
Yeah, to the chair, in terms of tobacco consumption or just?
In terms of Attorney O'Neill was citing the population size
Yep.
in Shrewsbury, what is the portion of that that is actually under 18?
That's something we can definitely look into that.
Because I think that is something to consider too. I mean, I think the demographics are different in Worcester than they are in Shrewsbury.
But also, to the chair, when this cap was set, we're looking at it from a public health perspective. He's looking at it from a business perspective.
Correct. How many licenses already exist in that particular area where Market Basket is?
I can ask my colleague Sherry to talk to that.
So overall in Shrewsbury we have 20, and on the side of for Turnpike, uh, I'm not sure about the exact number, but there are at least 7, 8, or 9 permits on that side, because Market Basket has 2, and then there's 2 on the side of Edgemere. There's Flynn's Market, Sperry's Liquors. So I would say at least, and then there's a smoke shop as well on route on that side. So yeah, approximately 8.
8 in that one area. Okay.
Good morning. My name is Tarek Yatim. Actually, in Market Basket across the street, there was 2 tobacco licenses that were granted to them. So they had a liquor store in there that sells tobacco, and then they gave them another liquor. And you guys issued another license as well for the supermarket. So there's 2 licenses granted for that one business.
They're 2 separate businesses.
Right. So Carrie, what is the next step?
We'll take this under advisement, Madam Chair.
Yeah, this is not a vote.
May-
this time.
Do you have
Hi,
any
may,
comments?
It's Cheryl.
yes, is it okay if I speak now?
Absolutely.
Thank you. My name is Cheryl Sabara. I am the Executive Director and Senior Staff Attorney for the Massachusetts Association of Health Boards. We provide legal education and technical assistance to the 351 boards of health in the Commonwealth. Tobacco is the only consumer product that, when used as directed, causes death. This is a density strategy that has been utilized in many municipalities in Massachusetts. I'm trying to get the exact number, and hopefully I will have that in a few minutes. But it is a long-term strategy to reduce access to tobacco products in a municipality. Shrewsbury has done this, has been down this road before. I don't remember how many months ago it was, but another retailer came in and asked you to amend your number, your capping of permits to a higher number. And you did not do it at that time. And it's true that towns grow, and I'm pretty positive that when Shrewsbury adopted this regulation, you capped it at a couple more permits than you probably had, and that was because towns grow. But the purpose behind this policy isn't to assure that the number of tobacco retailers is commensurate in all municipalities, so that everyone would have the same number of tobacco permits per capita. That's not the purpose behind the policy. The policy is to reduce the density of tobacco retailers for pretty obvious reasons. And when a business comes into a municipality, they come in knowing that their responsibility is to know what the regulations are in the municipality in which they wish to build. So I would just remind all of us the purpose behind this strategy. Yes, there is a cap. The cap is based on what the local Board of Health and what its residents feel is a reasonable number of folks that can sell this dangerous product. And you made a decision as to what that number was, and you've upheld it once. And I would suggest that it's reasonable if you decide to uphold it again.
Thank you. Thank you. We will take another advisement. Thank you very much for presenting your case.
Okay. And we just would ask you, if you can, to try and, just because you made a determination once, I don't know that that's cast in stone forever. And to just kind of keep an open mind to the situation, and also to consider the other effect of, as the spokeswoman said, that when people come to a town, they know what the limit is, and those are the conditions, but they may decide just not to come to town. And that's the other side of it. And I think if they don't come to town, that's also a consideration which can't just be ignored out of hand, and it's something that you should consider. So thank you for the time, and
Thank you. Have a great weekend.
Thank you, guys.
Yes.
Just have a little piece here. I just looked up quickly, about 25% of the population is under 17 and under.
Okay, great. Thank you very much.
Maybe a little bit higher, because that's 17 and under, not 18 and under. We're
Got it.
looking at a quarter at least.
Excellent. Thank you.
Yep.
Thank you. All right, next on the agenda, sorry, I went a little bit out of order. I tried to preview it at home and was not able to pull it up. So, next up is review and discuss coronavirus and COVID-19 updates.
Yes, good morning, Madam Chair. May I ask my colleague, Ms. Amelia Halton, to give an update? Amelia?
Hi, everyone. Good morning. From the public health nursing perspective, we haven't had any clusters that were reported to us this month in terms of COVID. I know that Shrewsbury has been having clinics, COVID clinics and flu clinics, and one of the pharmacists has been coming to take care of their vaccine needs. So that's wonderful. We don't really have much in terms of clusters in the area at this time for the month of October. And we have ended the arbovirus reporting for mosquitoes. And of course, the concerns are still out there, and people still need to be cautious when they go out into wooded areas. And also, ticks are still a threat this time of year. So from our nursing perspective, it hasn't been very active. It's been pretty low key.
Great, thank you. Anything else to add to that?
I'll just add that nationally there is a new variant called HV.1, which is again part of the Omicron family, so it's not expected to be something that would break out of the vaccine. So still is, but it's about 20% nationally, so new variants continue to develop, and vaccine continues to be effective, so we're still strongly encouraging people to get COVID and flu vaccines either simultaneously or at any point in time. There is no waiting period between the two vaccines per the updated CDC guidelines, so they can get it even sequential days or 2 days apart, 3 days apart, whatever is their convenience. Nationally, flu seems low for now, but again, Northeast, our region, flu peaks usually between December to March, so we are expecting the increase in numbers, but we're not there yet. And RSV is very slowly climbing, not too much activity in this area yet, possibly may increase as the winter progresses. But so far so good on the COVID, flu, and RSV front.
Great. Do we know if the rapid at-home tests are still sensitive to the new variants?
As best as we know, correct. There is no updated data published anywhere, but there has been conversation because, as you may recall, the federal government released COVID-19 tests, and some of them had an expiration date, and they clarified that those expiration dates were not really valid, that the test would still. And so in that conversation, they did mention that the tests are still sensitive. Now, whether it picks up, I think it's more to do with the timing of the test in relationship to symptoms rather than the test performance per se. So as best we know, it still works.
Great, thank you. All right, review and discuss the updates from the Central Mass Regional Public Health Alliance.
Good morning. I am Emma Stefanski, the Environmental Health Coordinator within the town of Shrewsbury. So going over the inspections that were conducted since the last Board of Health meeting, we've done a total of 85 inspections, majority of them being routine inspections and following up on any complaints that are received. We did have an establishment that had a small kitchen fire. They are back up and running. We did have a few complaints regarding the use of plastic bags within the town, as well as a foodborne illness investigation that needed to take place, and just a general sanitation of an establishment. I am actively working with those establishments to be in compliance with the food code.
Great,
Just one,
thank you.
one question,
Question?
Madam Chair. Do we require people who work in food establishments to wear masks if, when they're preparing food?
I do not believe it is in the code, so that I enforce the state food code. I believe masks would be a local ordinance or regulation, something that municipalities might set forth. There's nothing specifically in the code that says that that is a requirement.
I only ask because if food workers might have cough or other respiratory symptoms, and coughing into food could be equally potentially, especially when it's food that's not cooked or heated after. So
Yes, so just to elaborate on that, one of the main points that I do hit during conversations in my inspections is employee sick policies and procedures for when those sort of events happen. I'm finding that most establishments would prefer employees not to come in at all if they are experiencing any symptoms, but some establishments do have restrictions for what work can be done depending on symptoms or what exactly they are experiencing.
Great, thank you. Any other questions? No? All right. Well, I believe we are scheduled already, as I stated before, for November 9th for our next meeting at 6:30 p.m. Do I have a motion to adjourn?
So moved.
Second, Dr. Abraham?
Aye.
Myself, aye. We are adjourned.
Thank you.
Thank you.
Thank you very much.